Hello, everyone. I am Dr. Tahir from Youthful Medicine. In today's video, we are going to dive into a topic that is especially relevant to patients with lupus and how lupus patients tend to have more complications compared to other population. So I'm going to discuss a patient of mine who I saw um, last week about it was a follow-up visit for lupus, but she had recently developed COVID-19. And now we are in 2024. COVID is still going on, and patients with immune suppressive medications and diseases of autoimmune nature tend to have higher risk of complications. So, how to manage post-COVID fatigue and persistent inflammation in lupus patients is my today's topic of discussion. So this patient that I'm talking about was currently on this medication called Benlysta. It's a biologic for lupus. Previously, she was on hydroxychloroquine, which we had stopped. Um, I'm trying to remember what the reason was, but in any case, she was just on Benlysta. And when she had a bout of COVID, obviously she had to stop Benlysta because when you're dealing with an infection, you cannot be on current biologic therapies, which is true for patients who have lupus, rheumatoid arthritis, and who are on any biologic or immune suppressive medicine. So she's been struggling with uh, ongoing fatigue post COVID for last now about 6 weeks. And when I saw her, her labs show elevated inflammatory markers. This is something that we see quite often in autoimmune patients where they get an infection, we have to stop their immune suppressive maintenance medication, and they go into a flare. So today I'll walk you through the treatment plan that we discussed and how I am going to monitor this patient. And excuse the noise in the background, there's some construction going on in our office. Okay, so first let's talk about the lupus treatment. While this patient was already on Benlysta, I've recommended adding two medication. I added a small course of steroid to help relieve the immediate inflammation and add back hydroxychloroquine to help manage the persistent inflammation. Remember that hydroxychloroquine takes a little while before it kicks in. It may take you 6 to 8 weeks. So that's why I'm giving her some prednisone to get her through this tough time. Uh, Plaquenil has both anti-inflammatory and immune modulatory effects, which can especially be helpful in patients who are reducing flare-ups and long-term organ damage seen in lupus patients. And in my COVID-related patients who have post-COVID syndrome, I have discussed in prior videos as well that I usually consider an anti-inflammatory diet to support recovery and target supplements that I recommend to reduce inflammation and support immune system. In this case, I recommended her to make sure she take omega-3 fatty acids about 2,000 milligrams, turmeric, curcumin, bioavailable one about 2,000 to 3,000 milligrams based on her tolerance, and probiotics and essential vitamins like vitamin D, B complex. I also recommend magnesium to improve quality of sleep as well. So these would help her improve her fatigue and inflammation as she gets a little bit better, about 10-20% improvement. I would introduce some exercise in her life routine, walking to start with. So in addition to this, I would briefly mention that if the fatigue persists longer, I would consider modafinil at some point. So it is also important to monitor and assess lupus activity in post-COVID fatigue syndrome. Why? Well, lupus already creates a state of immune dysregulation, which COVID can further aggravate, leading to prolonged recovery and higher risk of flare-ups. So close monitoring help ensure that we do not miss signs of worsening of lupus, such as increased joint pain, fever, and further evaluations like inflammatory markers and biomarkers are important, like SED rate, C-reactive protein. I also check ferritin and for underlying inflammation that could persist, there are some other biomarkers that I will talk about at another video. So if you or your loved one has lupus and they're dealing with post-COVID fatigue syndrome, make sure to kind of share this video with them so that they can incorporate these um, recommendations and maybe talk to their primary care doctor, their rheumatologist, and incorporate some other interventions that could be helpful. And if you find this type of video and information useful, please subscribe to my channel, and which is Youthful Medicine, and hit the notification bell so that you don't miss any future updates on autoimmune diseases. I am also a quadruple board certified physician. I have board certification in internal medicine and rheumatology, obesity medicine, and integrative medicine. So I talk a lot about different topics of health, including autoimmunity, weight loss, inflammation, longevity, and preventive lifestyle strategies. And yeah, and until the next time, take care of yourselves and see you next time.